Human Services Committee. I'll be looking for a motion to approve the agenda, please.
Move to approve.
Support.
Motion by Leitner, supported by Palachek. All in favor? Aye. All right, we'll start with public comment. Any individuals wishing to address the commission will have 5 minutes from the first round. Any public comment? You okay? 5 more time. Seeing no public comment, we'll move on to the meeting minutes of June 10th.
Move to accept the minutes.
Support.
Motion by Commissioner Palachek, supported by Commissioner Rice, to approve the meeting minutes. All in favor?
Aye.
Motion passed. Region 2, Area Agency on Aging, the annual plan. Is there anyone here to address that?
I can speak on it.
Marcy, sure. We do have a copy of their annual plan, and an approval of this plan will be needed and sent to the full board.
There's a very strong tie between the Area Agency on Aging area plan and the item you have later in your agenda, the Department on Aging applying for grants to the Area Agency on Aging. In order for the Area Agency on Aging to fund certain programs, it has to be in their area plan. So that's what that document does. It outlines all the programs they plan to provide through federal and state funds for Jackson, Hillsdale, and Lenawee counties.
All right, thank you. In looking at the document that's in our packet, it says the Region 2 Area Agency on Aging is mandated by the State Office of Services to the Aging to obtain approval from each county commission in Region 2 before July 31st. And they're asking for our support of this document.
Yep. If you have any questions, I can try to answer.
Does anyone have any questions in regard to this document? Commissioner Rice?
Not a question, just a comment. I was part of that workshop with the AAA board and the council, and if you look through this, you can see it's extremely thorough and very complete, and obviously it's necessary for us to pass this. So, all right, thank you. Or address this.
So I am ready to entertain a motion.
I would move to approve the plan and send it to the full board.
Support.
Motion by Leitner, second by Rice. All in favor, say aye.
Aye.
All right, this will go to the full board then. Lifeway's monthly report.
Good morning, Commissioners. An update for Lifeways in regards to what's happening with local funding and other state updates. First item on the agenda is related to the work that we're doing with both Hillsdale and Jackson County related to facility support. And we're at the point now where with both counties we feel we are in agreement about what types of support that they will be able to provide from a facility standpoint for a building as well as for our group homes in both counties. For Jackson County this month, actually this week, the facilities gentleman Rick will be presenting to our full board with a proposal about what it is that they will be able to provide for us, and hopefully we'll be able to come to an agreement so that we can move that forward. The other thing that we're doing is we have had started initiation discussions with the Jackson County Sheriff's Department about the child care fund to kind of move that along to find out whether or not there's possibility of us being able to work on collaboration with services that they're both providing that could be services that Lifeways could offer that would then be able to offset the costs associated with the local funds. But again, we are just in the initiation discussion process, so I just wanted you to be aware of that. The other thing that we have been able to do since last time is related to the building itself in Lifeways. We have secured a short-term tenant, similar to last year, where it was the Hollywood Video section of the building, and they were bringing in a Party City Halloween type of for a short term, but it will be able to generate some income for that space. We are also in a discussion for a long-term 5-year lease, and hopeful that we might be able to work something out related to that as well. But again, we are in the discussion phases with CBRE for that. The other thing wanted to update you on was related to, as we had spoken last month about the interpretation of the mental health code and Lifeway's interpretation of what we're calling the ceiling and the floor as it relates to what the obligations are of the counties. We have had 2 conference calls with the department and a follow-up call this week, so we should have final resolution, at least from the department's perspective, as it relates to what is the obligation of both counties related to the local funding. They will then submit in writing to both counties and to Lifeways their finding related to that. So I just wanted people to know that that's where we're at this point in time, but a final conference call with them is this week. As far as a state update, many of you have probably heard about, you can't not hear about the Medicaid expansion and the fact that where we are related to that. As you know, Governor Snyder did come to Jackson and had a presentation about the importance of Medicaid expansion, and that it's more than just the fact that we have individuals who would qualify, but it's really about being able to provide preventative services to prevent individuals from even ending up in the hospital, where it costs all of us more dollars to serve them than if we were able to provide them preventative services similar to that we could do at Lifeways. We see the same thing. So really trying to advocate on behalf of the individuals for Jackson and Hillsdale County about Medicaid expansion, which now they're calling the Healthy Michigan Plan. And there is a website that they're asking individuals to sign up, and there's a petition and for people that are in support of a more bipartisan option to go to that and sign that petition. We're hopeful, we'll continue to be hopeful at Lifeways anyways, that we're able to do something that will be able to benefit individuals that we serve in Jackson Hillsdale County. The other key thing that's happening is we're continuing to move along with the regionalization. The first formal board meeting of the new region, the Mid-State Health Network, is in July. And we do have 2 appointments that occurred in the month of June from Lifeways, and it's Brad Boner and Ed Woods, who are appointed from Lifeways to be a part of the regional board. That is really it for my update. I'm open for questions now if you have anything in regards to my report.
Thank you, Mary Beth, for your report. What comments or questions might you have for Mary Beth? All right, seeing none, thank you for the
All right,
information.
thank you.
Next on the agenda, we have Department of Aging monthly report.
Now I could say good morning. On the monthly report, annual reminder that through the USDA, there are senior market fresh coupons where we give coupons to older adults who meet the requirements that are described there. $1,771 a month for one person, $2,391 for couples. They would be eligible to sign up to receive $20 in coupons for fresh produce at the local farmer markets, the farmers that sign up for Senior Project Fresh. So the date that those will be distributed is July 17th, so Wednesday. Excuse me. And the Fair Board and the County Board of Commissioners have an annual Senior Volunteer of the Year. And the next agenda item is the resolution honoring Cheryl Jones. And I just wanted to mention a few things. Cheryl retired from Human Resources at Macy's, and then she volunteered at our front desk for a few months. And then she was trained to help people fill out applications for food stamps. It's called My Cafe. And then she was trained in how to enter information that's needed for the Medicare Medicaid Assistance Program, and now she's going beyond that and receiving the 6 days of training that it takes to become a Medicare Medicaid Assistance Program volunteer and help people who have Medicare questions. So Cheryl's the one who was chosen by the Advisory Council on Aging to honor as Senior of the Year at the fair, at Senior Day at the fair.
All right, thank you, Marcy. Let's back up to Marcy's monthly report. What questions or comments might you have for Marcy regarding her report? Anything?
Well, I'm going on
You're going,
too. I have other things, but go ahead.
okay. Should we make that motion then for the honoring that individual, or no?
If that's your pleasure. I just wanted to mention about Cheryl before it got to that item on the agenda. Sorry if I confused things. Okay. Henrietta Nutrition Site. It's in the Henrietta Waterloo Township building. The attendance has been declining. We've done things to try to get the word out that the site is there. It's a hot meal served at noon, Monday, Wednesday, Friday. And attendance has declined down to 2 or 3 people a day. It might peak once a month to 7 people. And I have talked to Commissioner Lechka about this, and he, of course, referred me to the township clerks and other officials at the townships, and I have talked with Henrietta Township Board and Waterloo Township Board. And what we're doing is for 3 months, June, July, September, we have changed the site to 1 day a week. So what happens is the site leader comes to Crouch Senior Center and picks up hot meals that are packaged like a home-delivered meal, Meals on Wheels, and then any cold meals that the seniors might want, and then she's taking them out to the site. So the site is open on Wednesdays. And since May, we've been trying to encourage the people who attend the exercise class if they would like to take a cold meal with them. It's called Food with Friends. And at first, there were 10 people who took a Food with Friends meal, and then 4, and recently there hasn't been anyone interested in that. But between the two groups, we're thinking that we need to have at least 10 meals a week a day, which would be Wednesday, in order for this to continue after September 30th. So that's where we're at right now. And again, the townships understand that it's not cost efficient to have a site open and pay a site leader for 3 people. And their main concern, and ours as well, is to make sure the 3 people who have been going receive nutritious meals. And we are doing that. They can take frozen meals home with them on Wednesdays if they would like to, and then they could heat them up whenever they want for that next week. And should the site close, then we would, again, make sure that they have meals dropped off at their home. Until they're homebound, they're not eligible for Meals on Wheels. So it would be like a senior millage funded type service that we could drop off frozen meals at their house. So I'll let you know how the attendance is. Right now, it's still 2 or 3 people. So, any questions about Henrietta? Okay. And then the last item, Medicare Medicaid Assistance Program, wanted you to be aware that we received this funding. It's not something we apply for. There's no match. It's a program that evolved, so to speak, since 1990 when Michigan had the Michigan Emergency Prescription Program for seniors. That changed to a program called EPIC. And then once Medicare Part D began, then our staff received training to help people with their Part D prescription drug plan annual enrollment. So that's when we got more involved. Prior to that, Medicare Medicaid Assistance Program, or MAP, was all volunteer. But the Part D enrollment is complicated. You can go to the website, the national website, but you really need to know what questions to ask in the website in order for it in order for you to glean the best program for the prescriptions that you're on. So it does take some training, and we have volunteers that help people with this, but we have a lot of people calling with questions, and we have 2 part-time staff that help with not only Medicare Part D enrollment, but especially when people turn 65 and they're new to Medicare and they're wondering, okay, what health insurance supplemental should I get? What do I need to look for? What are my best options? And our staff will walk them through that so that they get the best insurance coverage for their dollar, basically. And they keep track of how much money, people come in and say, well, this is what I've been paying, and then the MAP volunteers are neutral. They're not selling a product. Our staff, too, we're not selling you this particular plan. Here's your options. And when they compare what they had been paying with the new option that they've chosen, people have saved in 2012 $1,850,000 in their own pockets. So that it is a very valuable program. The MAP funds don't cover the cost of our staff time, but again, it's a good service for our community because, it keeps money in their pocket that they can spend on other things. So I just wanted to let you know about MAP funding. And then that's not, any question on that before I jump ahead to grant proposal?
Any questions for her? All right.
Okay. The grant proposals then that we have from the Area Agency on Aging, that's separate from the MAP funding. And that is a separate agenda item, and I can talk more about it when it comes up on the agenda. And before I switch gears, we have another great thank you letter from someone. Every quarter, we send a survey out to one of our meal delivery routes. We have 14 routes. And one of the people said, I have been meaning to write a letter since last March. I want to let you know I've enjoyed the meals that are prepared. I enjoy the meals to almost 100%, except for a few meals. I would estimate that I really enjoy 95 to 98% of the meals. I mean, not everybody likes cooked cabbage, or something like that. And what also makes the program so nice are the people who deliver the meals. I really enjoy my meal transporter. And another one is also great. And thank you for your hard work your organization does. I couldn't afford to eat so well, and certainly not anywhere near the quality or quantity that you are allowing me. So that's pretty nice.
All right, well, thank you for sharing that. I wish my family would give me the same success rate on my meals that I prepare for them, but thank you. All right, moving on, following her monthly report, I will be looking for a motion to approve and send to the full board the resolution honoring Cheryl Jones as Senior Volunteer of the Year.
Move the full board the resolution honoring Cheryl Jones.
Support.
Moved by Commissioner Rice, supported by Commissioner Placzek. All in favor say aye. Aye. Unanimous? All right, then we have the Department on Aging, Region 2, Area Agency on Aging Grant Application.
In your packet is this information. It's a diagram of the aging network that goes from the federal level, Department of Health and Human Services. About a year ago, they added another layer called the Administration for Community Living, and then the Administration on Aging is below that, and that's where the Older Americans Act is located as far as the requirements for Older Americans Act funding, and that act began in 1965. So then the funding goes to the state of Michigan, which is part of the Department of Community Health and Office of Services to the Aging, and that's the entity that has the service standards that any organization that applies for funding, their requests for proposals have to include all the requirements in those service standards. There is a governor-appointed commission on aging at a state level. And then from the state level goes to the regional area agencies on aging. Ours is Region 2. And then on the outside of the area agency on aging, it lists all the types of programs that they fund. And then it comes to the local service providers. And then you also have in your packet a list of our current grants, but this I've added in yellow. I'm sorry, I've added columns on local match, so you can see how much local match the county is currently supporting these grants. So I foresee the grant application that will be due middle August will be the same amounts, if not less, as far as the federal and state funds, because there are federal sequester cuts that the Area Agency on Aging covered this current year. This current year ends September 30th. And so it could be less. In yellow, it shows that it's more than the minimum 15% match, because you can't provide in-home assessments on the $20,940 grant plus the 15% match. You can't do an in-home assessment for every Meals on Wheels client and in-home home care assistance client on that amount of money. So the county is supporting that program in addition to the 15%. The same with home care assistance. That's the bathing assistance in the lighthouse cleaning and the in-home respite that we provide. And the in-home respite. Those, right now, in our current grants, the match dollars are more than the 15%. In addition to that, there's senior millage money that provides case coordination and support, home care assistance, and in-home respite, so that we can provide hours of service beyond what the grant can pay for. So the bottom line for current local match for our grants is cash, the $129,249. And in-kind is the county supports Department on Aging programs through providing human resources, payroll processing facilities, our building, our lights and heat and cooling, all that value. It's calculated in a report called Maximus, and the value for the Department on Aging as of the last report is $450,000. So the county is paying for that support for our department and all departments in that amount beyond what appears in our general fund budget. So what we can do with that value is that's the in-kind. We calculate how much of that county support we report to a grant to show that the county is supporting it. It's not cash that we're reporting to the grant, but it's what the grant calls in-kind services or soft match. And the other one is occupancy. We calculate the value of our square footage, and especially for congregate, the value of the kitchen and the dining room is part of the congregate nutrition program match for that grant. Any questions about the grant proposal?
Questions or comments
or
regarding the
match?
grant application? All right, then we would be looking for a motion to authorize the board chair to sign the Department on Aging application for Region 2 Area Agency on Aging for the 2014-2016 grant funding, and authorize the Department on Aging to sign the statement and contract awards for ensuring funding.
Support.
Motion made by Commissioner Mahoney, supported by Commissioner Rice. All in favor, say aye. Aye. Opposed? Motion carried. Thank you, Marcy.
Okay, thank you.
I just have a little
Yes.
comment.
Yes.
Just for email us that way.
Yes. Yeah. Was Commissioner Rice asked me a question about it, and this morning I added that column, and I apologize, I didn't originally think to do that, so I will email that. Yeah.
Thank you.
Yep.
All right. Up next,
Should I send it to all commissioners or Human Services? Okay.
Sure.
Yep. Okay.
Thank you.
I wanted to,
So send it to the Administrator Overton, and he will send it out to all of us. Thank you. All right, next on the agenda, I believe we have a long-awaited introduction that is forthcoming. So as our Interim Director, Steve Hall, approaches to give us this introduction, I see we're very well represented from our Health Department.
Yes, my first order of business is to introduce our new health officer, Richard Toon, and let him make a few remarks.
Good morning.
Good morning and welcome to Jackson County.
Thank you. It's a pleasure to be here. Thank you for your support and for approving my selection as your health officer and Director of Health Integration. I've already started meeting with the staff this morning. We have a lot of work to do. And ask for your patience as I get oriented to Jackson County and to the Health Department's work. And I hope that we'll be able to work successfully together in the future. I'm looking forward to it. Thank you.
Again, welcome.
far as health department business today, you received our monthly report. I did talk a little bit about the National HIV Testing Day, but really today what we wanted to focus on was our 2012 annual report. Mary Riccadello couldn't be here today, so if there's any questions on nursing issues, feel free to send them her way. But I will briefly cover environmental health, and then I'll turn it over to Shelley. I almost called you Chevy. I'm thinking cars, apparently. As far as environmental health, for 2012, we're starting to see signs that the economy is slowly getting better, and I know as you guys have gone through the budget process, you've heard some of the good news as far as home sales and things like that, and for environmental health, that's always reflected in our number of sewage disposal permits issued, water well permits, and we've seen those numbers go up, and so that's definitely a positive thing. And it seems to be going up this year as well. So those are good news. We issued 146 septic permits in 2012 and 206 well permits. The other couple of things I wanted to touch base on is we have continued to offer what we call a Basics of Food Safety class, and that has just continued to grow and be well received. We offer that free of charge, and the idea there is that the Michigan food law requires every restaurant to have a certified food safety manager, which is a pretty extensive course. It's a 16-hour course that we actually co-teach here locally with MSU Extension. But what we wanted to do is hit some of those line staff in an opportunity to make the food supply here in Jackson as safe as it can be. And we offer that free of charge on a monthly basis. And last year we had 79 people go through that class. Other than that, I wanted to touch on the animal shelter just briefly to let you know how that surgery suite's working. We had 1,073 animals sterilized before they left the shelter last year. So that is positive to see. And hopefully we'll continue to see those intake numbers go down thanks to the fact that the animals are being sterilized before they leave. So with that, I will turn it over to Shelley to talk about health education.
I thank you.
Good morning, everyone.
Good morning.
I am going to Shelley Bollinger, and I oversee the health education and health promotion activities for the department. And those services can be seen on pages 13 through 18 in your document. And I am just going to go through and highlight some of those because obviously you have the full document and I don't want to go through an exhaustive list. But I will begin with our car seat program. In 2012, we provided 400 seats to community members and 456 education sessions. So within that program, we provide low-cost, brand-new car seats, short-term rentals. We do car seat inspections and provide safety education to families and agencies. We also, twice a month, provide education to the expectant parents program at Allegiance Health, which is the Stork Club. And there we do infant carrier safety and education. Our hearing and vision program, our numbers increased again yet this year, so we're really pleased with the way that program has been going. We screened almost 11,000 children in grades preschool, 1st, 3rd, 5th, 7th, and 9th. So we go every other year up to grade 9. And in our hearing program, we screened almost 7,700 children in grades preschool, kindergarten, 2nd, and 4th. And again, the all children receiving screenings went up, and the number of preschoolers receiving screening went up. So we're really proud of that, and a big part of that preschooler piece is the collaboration with Head Start and our larger daycares in preschools. Our abstinence program, again, we're continuing to receive a $100,000 a year grant there from the state of Michigan. We provide 15 hours of classroom intervention to all 6th graders in Jackson Public Schools. This past year, we served 343 youth providing education and activities focused on puberty, healthy relationships, teen pregnancy prevention, and sex education. Then in the summertime, we provide the Get Real Summer Program, targeting 10 to 14-year-old youth in the Southside neighborhoods in the city of Jackson. Specifically, 43 young people received education in a 5-week program. Again, we're educating them on life skills, the job readiness skills, how to manage money, how to save money, how to build their future. They're gaining life skills through education, field trips, guest speakers. We have an overnight retreat and then a parent celebration at the end. So in a nutshell, building hope for their future. We also, in our Jackson Tobacco Reduction Coalition, there we provide methods of smoking cessation, such as the Tobacco Quit Line through Michigan Department of Community Health, and we promote local cessation programs and provide self-help resources. We served 176 individuals in that program. Also, the lead for our Jackson Tobacco Reduction Coalition serves as the lead for our Tobacco Health Action Team, which is part of our health improvement organization and our community action plan, with the goal to reduce tobacco use rates and chronic disease through collaboration and community partnership. In this past year, we worked with the local school boards and superintendents to adopt a Level 3 or 4 comprehensive 24/7 smoke-free school policy, and that was initiated or adopted in 10 of our 15 local school districts, which includes public and private. Our Women, Infant, and Children program, you're probably aware that's probably the largest program that I oversee, largest budget, most personnel. That's a food supplemental program for women, infant, and children. This past year, we averaged a monthly client enrollment of 5,401. So, of course, that program is booming at the seams in the economic environment that we're living. In that program, we also have a collaboration with Rec Connect, and that is to increase physical activity with WIC families, teaching parents how and where and why to have physical activity in their children's daily life to decrease childhood obesity. And we also continue to provide lead screenings, which is an add-on piece with the WIC program, should you choose. And of course, we find detection and treatment of lead poisoning very important, as it can cause brain damage in children under the ages of 5. So in 2012, we screened 761 children in that program. Page 15, we're still providing Medicaid outreach, and this is really assisting families with the application process for both Healthy Kids Medicaid, My Child, the MOMS program, and Plan First for family planning services. We also go on site at 2 alternative schools, T.A. Wilson and Western Options, where families and children need services. And our statistics for the state of Michigan, and this is 2011 stats. As you always know, we're always behind with stats. It takes a couple years to get the current year. But in Jackson County, 16,825 0 to 18-year-old children are enrolled in Medicaid. And My Child, there's 546 0 to 19-year-olds enrolled in My Child. Under chronic disease prevention, you've heard me come before you for the Healthy Communities Strategic Implementation Team, which also I serve on the community-wide health improvement organization. And with that, we have done a lot of work, and we now have 6 health action teams that are focused on the 2011 community health assessment data, and those areas are behavioral health, smoking, nutrition, physical activity, community engagement and awareness, so that's our outreach piece, and then the community collaboration, which is the clinically integrated network and the collective impact model piece. And of those 6 health action teams, the health department has leadership of 2, which is the smoking health action team and the nutrition health action team. So we're extremely proud of the work that's being done there. We do have an updated community action plan, which serves the 2013 to 2020 year plan. So I have, I believe, 10, 11 copies here. So if all the commissioners would like a copy, as well as our administrators, I'd like to leave those here for you. We just received those. And then on my last page, the Senior Health Promotion Program in 2012, again, we surpassed the Region 2 area on agency's requirement of reaching 142 non-duplicated participants in the fitness classes. Collectively, we actually had 533 individuals participating in the various physical activity classes, which is awesome for Jackson. Working towards that chronic disease prevention piece as well, and the data on those classes are in the report on page, I believe, 18. And then finally, the Teen Pregnancy Prevention Initiative. We do continue to serve and coordinate the Teen Pregnancy Prevention Initiative through funding through United Way. And with that, our goals are to conduct quarterly advisory committee meetings, to maintain an active teen advisory council, and also to work with the school sex ed advisory committees to ensure that they're using evidence-based curriculum. Within that, we've also been able to, through, again, another, I believe it's $100,000 a year, we are teaching the Teen Outreach Program through a Taking Pride in Prevention grant through Michigan Department of Community Health. We piloted that for a semester in 2012 from January through May. And with that, we had 11 what we refer to as TOP for the Teen Outreach Program, 11 TOP clubs at 4 different sites in Jackson, which would be T.A. Wilson, Western Options, Middle School at Parkside, and the Da Vinci High School. And within that, we provided a minimum of, for the children, 32 lessons, including 10 hours of community service learning, which is the awesome piece that brings it full circle. So we served 111 students. It's a very intensive program. And then we did begin the full year implementation, the second year, which began in September 2012, which we're still in for this school year as well. I also encourage you to read those testimonials at the beginning of the report, because that really talks about the services that we provide and the customer service, which is of highest priority at our department. Any questions?
Commissioners? Commissioner Rice?
Thank you, and Steve, and this could be for either one of you to answer. I mentioned this once before. I find it interesting that when you add up your pregnancies here, you have estimated miscarriages, live births, and you include abortions. I realize there's confidentiality issues, but is there estimated abortions in this county?
There would probably be actual abortions, yes. But of course, then you have to estimate with miscarriages or abortions that don't occur in a clinical setting. So I guess it would be an estimate. But the reason that you see that indicated, I think, Commissioner Rice, that you're referring to with the teen birth rate, obviously it would have to include abortions and estimated miscarriages. So those numbers would be available, because that's how they get that estimate.
Is there a reason they're not reported on this document?
We could report it in the document. We just never have. It's through Vital Statistics, MDCH, all that information is available. I suppose it would be a little controversial, and maybe that's why it's not laid out in the report, but there's no reason that we couldn't, or that you couldn't have that data.
Definitely controversial, but I just don't see a problem in putting it on here myself, but I'm not the final decision maker here. I'm just something that, from my perspective, it could be on there.
Sure, thank you.
Commissioner Mahoney?
Thank you. Carl, I think that should be something that we should give us hope and trying to
I can report that I do know that our teen birth rates and our teen abortion rates are on the decline. It's not that one's going down and the other is going up. So, but yes, I can get that information for you. So,
Commissioners, any other comments, questions for our Health Department? Commissioner Shotwell.
No, that's fine. I was actually on vacation that week, and when that happened, and I looked at my wife and I said, boy, I might have to go back. The way investigations work, though, this is an interesting tidbit. The racetrack, 3 turns are in Lenawee County, and 1 turn is in Jackson County. So we do not do anything with the racetrack. Our only involvement is with some of the temporary campgrounds and stuff like that that are within Jackson County. And so we have nothing to do with that. So the fact that that hit during the Tough Mudder event, which was at the racetrack, Lenawee County handled all of that. We did field some phone calls and refer them on to Lenawee County. And the way that works is the county that the investigation starts handles the questionnaires and so forth. There was a point later in the week that Lenawee County was basically overwhelmed with phone calls that Michigan Department of Community Health did ask other counties if you had any sick residents in your county, and they called to go ahead and do the food histories, which is we look back 3 days and collect that data. So really our involvement was fairly minimal. Like I say, other than fielding some phone calls, referring them on. A survey was developed, a quick Survey Monkey survey that was anonymous that we could refer people to. So, knock on wood, we were fairly fortunate in that event. And we were in contact with them, like I say, and with their nursing staff. Our communicable disease staff was in contact with them, and as far as also referring, and if they needed our help, we would have helped them, but it didn't come to that point. So, anything else?
Thank you. Any other comments, questions for anyone from our Health Department?
I can say one thing on the annual report. If you look at that, the front page letter to the community, I had to write it. I tried to get Ted to write it because I said he was the health officer for 2012, not me, so he didn't bite.
And Commissioner Leitner, are you going to give me a motion?
I move to accept
A motion to receive?
to receive the community action plan.
All in favor? Aye. Thank you. All right, thank you, Health Department. And again, Mr. Toon, welcome to Jackson, and we look forward to working with you.
Thank you. What? Do you want me to say that? Okay. Okay. I'll do it after the animal shelter.
Okay. All right. Up next on our agenda is Community Action Agency. And as Toby approaches, I will make a motion to receive a document, a letter that she is sharing with us.
Move to receive.
Motion, all in favor? Aye. Thank you, Toby, and welcome.
Thank you. I will start with that letter that you all have. I got a copy this morning from Mr. Shotwell. This is to indicate that Misha recaptured $4,261 of our CDBG grant. When we receive program income, anyone who sells a house or has payments on their CDBG grant, we receive program income into our account. Anytime that gets above $5,000, we are required to spend that first on a project. And so when we get program income booked right at the end of a grant term, we have to spend that first, and sometimes grant funds will then have to go back to MISHDA. And that is what happened this time. We got over our $5,000 of program income, had to spend this on a project, and then this money went back to MSHDA. I do have some information from MSHDA that amount may be changing soon, may be increasing, so that we don't run into these types of issues as much in the future. So that's this letter that you received. I also handed out this MyRep packet. Community Action Agency publishes this every 2 years. It's typically out of date the minute we publish it because someone resigns or retires, and so it has all of your county and city administrators and council members, commissioners for all 3 counties, as well as the school boards with their websites and other information available. We do have, I brought a handy box full of these if anybody is interested. We also have a PDF version of it on our website, so it's available for people to look at.
Yes, I will note, Toby, that Director of Health, Mr. Toons.
Right.
Yes, yeah.
The minute it's published.
Absolutely.
For community action updates, as you may have read in the newspaper, we received a grant from HUD of just over $21,000 for housing counseling. I wanted to indicate that that is actually a tri-county grant, not just for Jackson County, so Jackson-Lenawee and Hillsdale, to provide foreclosure services and home buyer education and counseling. We also were notified on Thursday that we were awarded $668,000 through the Veterans Affairs, Department of Veterans Affairs, for supportive services to veterans' families. That will be also a tri-county grant. We will be able to provide direct assistance to veterans for car repair, transportation vouchers, moving costs, child care, rental assistance, and utility assistance. Unlike many veterans programs, this is available for any veteran and their family. You do not have to be a wartime veteran, and that funding will begin October 1st. We anticipate several months of training. We've already been told that they'll be coming down to work with us, and we will be working, and we're supported in our application by our local VA office here, as well as the ones in Lenawee and Hillsdale. For NSP, we have completed our acquisitions at this point in time. We have 10 properties acquired. 5 are currently under contract and in several stages of repair. An additional one will go into contract this week. We are working with Habitat on 2 projects that will be under developer agreement by August. And we have one coming through the right of first refusal process that you all approved through the tax foreclosure. We have expended $707,000 of that grant. We have committed $222,000, so we are just $233,000 from our required expenditures, and I don't anticipate that we will have an issue having that completed by the deadline. We are getting ready to open applications for home buyers. I have some training that I need to do with my staff in the next 2 weeks, so by August we will be taking applications for home buyers. And there will be a marketing effort so that that gets out to everyone to be able to, who's interested, to be able to apply. And we would like to do an open house in August so that everyone can see the progress that we've made. One last CAA item is that we've completed our volunteer income tax assistance in Jackson County. We serve 3,774 households, or 5,683 individuals, bringing in $4.7 million in refunds and credits to Jackson County. And that's it for my report.
What comments or questions might you have? Commissioner Placzek?
It's going back to the Veterans Affairs. Is that for any veteran serving at any time period, or is there a...
I believe it's for any time period. The information that we have so far right now is that we've been awarded, and so they will be getting out all of the other requirements to us, but our understanding was it was any time period, any veteran.
Thank you.
And their families.
Commissioner Mahoney?
I know
We actually didn't return 300,000. We only returned 4,261. 300 was the full grant amount.
Oh, okay.
So it was 4,000.
Okay. Thanks.
You're welcome.
Commissioner Rice?
Hey, Toby, just a comment. You're almost there. And thank you for your patience with some of the other commissioners on this. Thank you.
All right, Toby, anything else? All right, thank you.
Thank you.
Next on the agenda, we have claims. The June claims need to be paid. Motion made by Commissioner Mahoney, supported by Commissioner Leitner. All in favor, say aye. Aye. Against? Passed unanimously. Other minutes. In your board packet, we have the VA May and June minute meetings. Oh, Commissioner Rice? Oh, I'm sorry. The animal shelter. Absolutely. Mr. Hall?
Thank you. For the quarterly report for the animal shelter, a few things I wanted to touch base on. Yesterday was the third Jackson Cat Project, where again we spayed and neutered. The goal was to spay and neuter 100 cats between the animal shelter and the Humane Society. Dr. Owings and Dr. Anderson kind of spearhead that, and those slots fill up fast, so it definitely shows a need, and I know they hope to continue to do that. And Dr. Owings is very good at getting donations, so that's been a worthwhile project. I also want to let you know that I recently met with a donor who wanted to donate about $5,000 to the animal shelter, and we were looking at, I don't know if you've ever been out there, but the surgery suite wall doesn't go all the way up, so there's a lot of noise and stuff like that, so we're looking at extending that wall up and taking care of that and fully enclosing the surgery suite. And I really wanted to focus on Friends of the Animals for the Jackson Area Inc. I believe it was my last quarterly meeting. We brought a board member here for you to meet. But I outlined in my report some of the stuff that they've been doing, but I really wanted to focus on that last bullet item. Since June 2012, they've donated $31,000 to the animal shelter for different projects and things like that. So it's just been a great relationship, and hopefully we continue with that. But they've just been a godsend to deal with for the animal shelter. So, and then I had one last thing. I did want to let you all know that on Friday I tendered my resignation. I have accepted the position of health officer for the Central Michigan District Health Department. So my last day in the actual office will be August 9th. So tough decision. I really enjoyed my 10 years here with the county, and especially working with all of you. So it'll be a new experience.
Well, Steve, I will be the first to say, first of all, thank you for your many months of helping us in this interim position. We appreciate the extra hours and dedication it took, and it is bittersweet, but we do wish you well with your new endeavor. So our loss is their gain.
Thank you.
Commissioner Mahoney? All right, next on the agenda is the August reporting schedule is listed is Department on Aging, Health Department, Lifeways, and RSVP. Again, that's in August. Where now leads us up to the final public comment. Is there any public that would like to address the commission? Any commissioner comments or committee member comments? Commissioner Rice?
He wasn't expecting this, but we can also, when you get a chance, Nate back there, when you get a chance to see him, he's going to be moving on as well, so you might want to say hi to him. He's hopefully going to end up with much better things as he moves forward as well. So,
Any other commissioner or committee member comments? All right. With that, I will move to adjourn at 10:57.